So thinking about treating knee pain, now I'm talking about the sort of pain which is a strong or a dull throbbing ache, sort of thing which gets worse when you go for any length of walk, or perhaps when you go up and down stairs. Might be very stiff in the morning, might be stiff if you've been sitting for some time. If, on the other hand, you have a hot, red, swollen knee, you've had a recent injury, or you're getting really sharp stabbing pains, or the knee feels unstable, then you really need to go and either see your GP or come and see somebody like myself to get a diagnosis and to get some hands-on treatment. But knee pain, which is an ache, does respond well to self-treatment. And so I'm just going to run through a few simple ideas to show you what you could do, what positive things you can do to help yourself. The first area I want to talk about is trying to keep the joint fit. Now, the normal reaction when you have pain is to think, oh, I've got to protect that area, I shouldn't overdo things. And absolutely, don't go for really long walks, don't aggravate it too much, but you do need to keep the muscles around your knee strong, because if they're strong and they're flexible, they will protect the joint. So that's the quads, the hamstrings, and the gastrocnemius muscles here, so all around your thigh and at the back of the calf. And I have got some short videos up on YouTube that will show you how to do that. And they'll be really effective for protecting your joint. Also important to keep them flexible, so I've got some films up there that will show you how to stretch those muscles too. And that's the first thing that you can do that will be helpful. The next thing that you can do is keep the area warm. Put a hot water bottle on it and keep it well covered. Don't let cold get in there, because cold always tends to tighten things up a bit, and that makes things feel worse. And the third area that you can think about is having good footwear. If you go to a good running shop and you get some really good trainers which are fitted for you, which give your feet good support and some good cushioning, that will help as well. So those are three simple ideas to start off with. And then what I want to spend the rest of the time doing is talking about how you can do some massage work to actually work hands-on around the joint and all the way down your leg. So I come from a Chinese medicine tradition as well as being a physio, and I work very much with tuina Chinese massage. And that's great for treating muscle and joint pains. So the three areas we're going to focus on today, which is where most people feel pain. First one is on the inside of the knee here. The second one is around the front of the knee, just below the kneecap or under the kneecap, across this quads tendon here. And the third one is down this lateral side. You might feel it sometimes sharp pain in the outside of the knee here, but very often tracking down around the head of the fibula. So those are the most common places that people feel pain in the knee. And what I want to do is show you first of all some techniques that you can work with to treat those, and then we'll go on to putting the treatment together. So the first technique I want to show you is called roll far, and it's a rolling, kneading, circular movement. So if you can see, I'm keeping my thumb nice and straight. I'm taking a little bit of weight through my fingers. My thumb is sinking into the muscle. It's not strong, I'm not pushing really hard. I'm just letting it sink into the muscle to find a comfortable depth. And then I'm sticking to the skin and circling round. And it's a nice steady movement, okay, with a nice steady pressure. So just try that a couple of times on your leg. Move from place to place, lift up, sink in and circle. Keep your shoulder nice and relaxed whilst you're doing it. You don't want to get pain somewhere else. And then we can also do this roll far with a whole hand. So the same technique, it's just circling with your whole hand. A little bit more emphasis from the heel of the hand. And you can see I'm moving around, but I'm sticking to the skin, lifting up a bit, and then sticking and circling again. That's the first technique, roll far. The second technique is called more far, and it's a circular rubbing. It's a bit like what you do when you want to rub something better or when you want to warm something up. So this is more far. You can feel it straight away when you do it. Nice and relaxed. Keep your fingers relaxed. Keep your shoulders relaxed. It's nice and loose. And you can feel straight away that it's warming things up. The third technique that we're going to do is toi far. So I practice tuina, and toi is one of the techniques, words which forms part of that massage, word for the massage in Chinese. And toi far is a downward stroking technique. It's a really nice long, you feel like you're clearing things out. And if you can see, I have this nice V shape with my formed between my thumb and my fingers. So the fingers together and the thumb open wide. It's a bit like you see on a snowplow. And in Chinese, that's called hu kou, which means hu is a tiger, kou is its mouth. So imagine it chasing everything out and away. So it's clearing things, it's clearing all that blockage around your knee joint and helping things to move. So that's the third technique. And the fourth technique we're going to use is a squeezing technique. Chinese is called Gbar. And it's very much like you're squeezing something out of a tube. You're pushing things down and out. And again, it's nice and soft. So you're squeezing between your fingers and your thumbs. And it shouldn't be pinchy. It's not too strong. You're just encouraging things to move out. So Chinese thinking and tuina, we're always trying to clear things away. So the idea is that if you've got pain and a collection of stiffness and pain in one area, it's because that area has got blocked. And the qi and the blood circulation can't move through it easily. So if you thought about this in nature, it would be a bit like a stream which has got a blockage across it, so twigs and leaves and that sort of thing. And the river or the water is pounding against it, trying to get through. And that's very similar to the throbbing feeling that you might get in your joint. So the idea is to clear that blockage. And to do that, we need to make sure that below where the blockage is clear so that it can run away. It's a bit like when you want to clear a stream. You don't want to move all the twigs here for them just to collect lower down and have to do the job all over again. So it's worth just checking that that flow is free before you start to work on the area which is painful. So we're going to start the treatment by working below. Make sure you're sitting comfortably, you're well supported, you're nice and relaxed. And we're just going to start with a roll far, and you're just going to open up, take some weight through your other arm, so your back is a bit supported. You're going to work right the way down and all the way out of your feet. And the same all the way down this outer part of the outside of your leg, and out through your feet. So nice and smooth, just opening up in your own time. And you might do it's a little bit tender down here, and that's okay. And we're just going to get that all moving. Don't press too hard, but you do need to feel that you're opening up the muscle. You can come a little bit around the back of the leg as well. And just get those muscles feeling a bit soft. We can do some of that squeezing Gbar technique, moving right down and out of the toes. Imagine you clearing a stream or a waterway, and you just want it all to flow nice and smoothly. And then we'll do a little bit on the other side, because it's always good to balance the two legs. And if you feel you need to do this for longer, just keep going whilst it feels comfortable. Now I'm going to come up onto the knee, and we're just going to palpate around a little bit so that you can find where your pain is. Now if you get pain on the medial side, we're going to start there. So you can see I'm doing the roll far, and I'm just feeling around inside my knee here and just seeing what I find. And I can find, oh, just there's a little bit of a tender area. And then what I want to do is just check on the other side, is that side also tender? And no, it's not quite so tender there, so I know that's an area just here that I want to focus on when I come to treat the knee itself. So that's if you've got pain on the inside here. If you've got pain across the front, we're going to do exactly the same, but just this time with your two thumbs. And you can work all the way up underneath the kneecap, just below it, and around the bottom of it. And you might find, that's feeling a bit tender. Does it feel the same on this leg? No, not quite so bad. So I think I've got a sort of connection of these two pains going on here. So have a little bit of a feel around. And then if you have pain on the outside, exactly the same thing. You're just doing that circling roll far, and you'll find there's knobbly bits of bone. Just work around the sides of those. Come down, and you'll find the head of the fibula just here. It's like a big bump. And it is quite tender, but I think that's probably might be that it's just as tender on my other side. And yeah, that's pretty tender around here. So that might be normal. That's why it's always good comparing with the knee joint that you don't have pain in. Because some areas just are a little bit more tender. Okay, so we've opened up down here. We've done some roll far, and we've made sure that stream is nice and clear right down into the foot. And we can do a bit of tway far just to make sure that flow is happening, like the tiger's mouth, pushing everything, chasing everything away. And then we're just going to come and work on those tender areas, wherever you find those tender areas on you, and just work around little circles. Oh yeah, a bit sore. Don't press on it too hard, but you need to know that it's a little bit sore so you're on the right spot. Just keep circling around, opening it up. I'm going to do a little bit of rubbing with my whole hand, and I'm going to take that down, clear it down the rest of the channel, the rest of the stream. Make sure it's moving away. And as I say, you can work on that for as long as feels comfortable. Don't overwork on it, and don't keep working on the sore bit because you might just irritate it. Keep a little bit of work where it's really tender, and then take it away. Make sure it's clearing. And then come back again and work around a slightly wider area. And then if you're working on the front of the knee, you can come into, this is what they call the eyes of the knees. They're very important acupuncture points for treating the knee joint. And you can see I've got my hands resting, fingers resting at the back of the knee, and I'm just circling around with my thumbs on the front. Feels very nice to open up the knee. Good for pain anywhere in the knee, but especially this frontal knee pain. All the way down there, and then I'm going to take it with the Gbar right down and out of my feet. And then if I had pain on the outside here, again focusing with that roll far where you feel the pain. Clearing it away, taking it down the side of the leg, and then coming back and working on a slightly wider area. Moving down, and then I want to bring good stuff from above. So I'm back to my Gbar again, squeezing down the thigh, taking it all the way through, so I'm encouraging that circulation to bring lots of good nutrients in, and then take the bad stuff, the waste products, away and out. Always connect things up. So a little bit on the other side is nice, because you want to work as a whole. And I also think it's nice to work on the other leg so it doesn't feel left out. You don't want to bring all your attention into this area. Also, don't give the painful area too much of an inflated sense of its own importance. Good. Now your knee should be feeling nice and warm. Give it a bit of a move around in between. That also helps the circulation, and it helps you feel that it's just getting a little bit better. Good. And then we'll just finish with some more fire, just giving it a nice rub. Making it nice and warm. I say you can use those techniques around your knee for as long as you feel is comfortable, always working downwards. And then I just want to come on to show you a few points that you can work on. Now in Chinese medicine, it's the qi of the kidneys which supplies and protects and nourishes the joint. So I want to just work on one of the kidney points, and this is the point on the ankle here. So if you find the medial malleolus, which is this knobbly bit of bone on the inside of your ankle joint, and you put one thumb on there, come back with your other thumb and you fall into a little hollow before you get to the Achilles tendon. And that is the major kidney point, one of the main kidney points. And it's a really nice point to treat if you have any joint pains. It's good if you have back pain, it's good if you have knee pain, hip pain. And again, I'm using my Rofar, my fingers are taking a bit of support, and I'm circling with the thumb. Nice, slow, steady circles. And it should feel achy. If it's achy, that's because you're stimulating that point. So you can work on for that. Close your eyes, I often do when I'm working because it gives me a better connection with the point. That's a nice point to work on. And then the other kidney point is this one on the ball of the foot. Just right in the centre. You can probably see I'm working with my fingertips in the centre of the ball of the foot, and just again roll far and rolling around on it. And again, it's a little bit achy. Don't press too hard, but you want to feel a little bit of ache from it. And then of course always balance out with the other side. I'm coming off that knobbly bit of bone and just into that hollow before the Achilles tendon. Move that out of the way so you can see a little bit better. And circling around, close my eyes, connect with that point. And then I'm going to come onto the ball of the foot again. And just work with that kidney point right on the centre of the foot, the ball of the foot. And just you try and feel for yourself how long you need to stay with that. Good. And then just below the knee, if you come with both your thumbs, if you're on the edge of the knee joint, then you're just sliding down, just towards the top of where the muscle starts to bulge out, you'll find another little hollow. It's below that bony bit to the head of the fibula. And just again, if you press in there with your two thumbs doing rofar, you will find again a bit of an ache. And that's another great point. It's a stomach point this time actually, but it's good for treating anything wrong with the legs. And I'm just circling with both. Keep your shoulders relaxed. Feel it a bit achy. And then come in and just rub around the knee joints again. Give a bit of a movement with the knee. See how it feels. Maybe just stand up a little bit. Have a bit of a feeling as to what that's like. And hopefully you'll notice a difference, that the knee feels freer, it feels a bit warmer. And that's the sort of treatment you could do once a day, as a whole treatment like that. You could do little bits of it if it fits in better with your lifestyle. As I say, the main things are work slowly, really focus. Don't get stuck on one point. Keep this idea that you need to connect everything together, and do keep moving the joint a little bit in between. And remember also to keep it fit and to keep it flexible. And of course, if it's not helping the pain, find yourself someone who can do some hands-on treatment, or pop into your GP and just check that there's nothing else that needs to be sorted out.